Next we're going to be doing splinting for the fingers and thumb. First one that I'm going to show you is going to be the use of a stack splint, and these come in different sizes. The numbers are down here at the base. These are for hammer finger, which will typically look like an avulsion of the tendon in the back, flexor tendon, extensor tendon. So it's usually stuck, the distal phalanx is, distal interphalangeal joint is stuck in flexion. So with this one, again, once you find the appropriate size, you would slide the splint on, and this will help keep it into neutral or maybe even a little bit of an extension. And then you can either, tape that on, you can either use the 1 inch or the 1.5 inch. And again, you can check for capillary refill at the finger and sensation. And that's it for the stacks. Stacks, S-T-A-X. Next we have something called Aloma Foam. And with this, it has aluminum on one side and then it has foam on the other side. And again, these come in, these are rigid splints that are good for fractures. And we're going to demonstrate a couple different ones to put on. Ideally, when you're splinting, again, you want to try to immobilize the joint both above and below the fracture site or dislocation. With this one, you want to put the foam part against the skin. And then once that's on there, again, you can ask the patient to hold that on there. And again, this is going to just tape that on, above and below. And once that's secured, go ahead and flip it over. Go ahead and see, if we needed to, make any adjustments and flexion at any of the joints, we can do that. Check your distal and capillary refill and the sensation for the body part. After that, we might also have a situation where we want to apply the splint both on both sides. So with this one, we can use in the same finger. We're going to keep this is again the Aloma Foam. We're going to put this just past the carpal the carpal metacarpal joint, and then right at the end of the finger, we're going to bend this so it'll go around the finger. And again, if we wanted to, we can do it on another finger. So once that's on there in place, again, we can tape that above and below while the patient is a joint. So again, that's isolating the joint again in all three joints. Again, we can check the sensation down here by the finger. We don't have access to the assessed capillary refill. Next, we are going to apply a splint using various types of what's called baseball splints. And these have a blue foam. They have aluminum on the back as well. but rather than the white foam like the other one, these have a little blue foam in the back. And again, depending on what type of splint you want to use, these come in different shapes. And again, these can also be folded to the different body parts. This one here is for the pinky. So again, with this one, this is going to go across the joint. And again, folding those over. And then the bottom, if we needed to, we can push that down. And again, with these, we don't need to. If we needed to tape those on there for more secure, we would want to do that as well. We also have another splint. Again, this is just kind of a hook splint. Again, putting the blue foam side down. Just the tip of his finger is going to be resting on the end of that. And then we would apply our tape on there to secure it. Checking our capillary refill and sensation, and to make sure it's effective. Next we have another one that we have is a little bit longer. Is it the index finger? So this is going to go right over the top of the index finger, and again just closing it carefully over the fracture site, and then using our tape, we would tape that on the finger. And again, you can check the sensation where you can see it, but you can't check the capillary refill on this one. If you had more joints that you needed to cover, we have this one that has 4 arms. You see, that'll go over a longer finger. So this should just stick over the end of the finger, and then just move each of the 4 ends to the center. Again, the blue foam goes in skin side, and then again you can attach this both above and below the joint. Either 1 piece of tape or 2 pieces of tape, whatever you need to hold that. Okay. And the last one that we have for the baseball splint, we're going to use for the index finger. And this is going to cross our 3 joints again. So again, we're going to attach this one. All right, go ahead and flip your hand a second. There's the index finger.
Yeah.
So once that one's on there, we can go ahead and close these off. Go ahead and flip that over. So make sure that these are all closed, and if we still need to make it stabilize a little bit more, we can put our tape on there. 1 or 2 pieces if we needed to. Okay, go ahead and flip that around. And you notice that it crosses the 3 joints to help it stabilize it a little bit better. And again, you can check the sensation down here by the finger. And then the last one that I wanted to show you was a SAM splint, and this is a small SAM splint. It's about 3 inches or so, and by about 1.5 inch wide. And this one can be used for a finger or thumb. So first one for finger splint, you're going to fold it right in the middle. So you form kind of a little V. And then again, if we can use the pinky. So with this one, once the pinky is on there, then we can close up the front and the sides to stabilize it. And then once that's on there, then we can again tape it on there to secure it. And then we can check sensation. And then lastly, for the thumb, we can also use the small one, or we can use a bigger splint if you don't have it. But this one's going to go right around the base of the thumb, and usually, like, rather than using the patient's thumb, I may just mold it on my own finger first, or thumb. And again, depending on the position you find the thumb in, depending on how much flexion and stuff that you have to put into the splint. But again, once that's on there, you can attach it here across the thumb. And then again, if we had a wrap or tape, we can also secure it around the hand. Okay, and then again we can check sensation to the tip. And that is our mobilizations for the fingers and thumb.